While services at the Charlotte Maxeke Academic Hospital may be closed for now, vaccinations have not been impacted. There are long queues at the hospital at the vaccination center there as healthcare workers wait to get their jabs. Government aims to inoculate 1.5 million of them by the end of this month. But the administration has been accused of rolling out vaccines too slowly. eNCA's Heidi Giokos is at the hospital to see how things are going and joins us now for an update. And Heidi, we saw those snaking queues a bit earlier on, those being healthcare workers. How is it going at this hour? You were earlier estimating about 4 hours it takes from the time a person arrives to the time they get a jab in the arm.
Yes, certainly, Tulas. I must say that there has definitely been a smooth process here at this vaccination centre here at Charlotte Maxeke. And we are actually joined by Mr. William Malebati, who is the head of infection prevention control here at the hospital. Thanks so much for your time, sir. I think let's just start off with this specific vaccination centre. How has it been faring? Have you been seeing healthcare workers willing and eager to get the vaccine?
I can say that since we started with the vaccination program, initially the number of people coming, they were just staggering. But as we move on, we started to see an overwhelming majority of people coming for vaccination. I can tell you, and now if you can see even outside, the number are increasing daily, every day. So people, they are really heard the message, they are coming for vaccination. And the other point that I want to raise, and this thing of a third wave, that people start to panic and they want to have a protection. That is why now we start to see so many people coming. The number really are satisfactory. We are happy about the number.
You speak about an increase of numbers because many are concerned about the third wave. Speak to us about whether or not this vaccination centre has the capacity to take on more people willing to get the vaccine, especially now with phase 2 beginning on the 17th of May. Are there enough vaccines? Are there enough personnel to administer these vaccines at this vaccination centre?
Yes, and our vaccination centre, remember that we are depending on RHI, which is Reproductive Health Research Institution. Those are the research institution that is assisting us with the supply of vaccines. Yes, we do have vaccines as we speak that we can vaccinate the number of staff members that are coming over here. And then we come into the vaccinators. The institutions that are around us, they are within our cluster, are the ones that they are assisting with the vaccination of the vaccinees. So in terms of that, we are really capacitated. The only challenge that I can raise is the creation of vouchers. Majority of the people like we receive today, they don't have vouchers. And that's really delaying the line. We've got the vaccinators, but when coming to creation of voucher, remember, voucher is not created by us, it's created by EVDS, which is the responsibility of the National Department of Health. So majority of the people that are coming here, they don't have vouchers. And this really delayed the line. Once the line gets delayed, it is seen as if the vaccination process is slow. But if we can fix the issue of creation of vouchers, I can tell you the line will be as fast as a lightning.
Why is there an issue with the creation of vouchers? Is it because you are seeing those the age of 60 and above that are only supposed to start getting vaccinated as of the 17th of May arriving today? We saw some elderly in the queue, and we understand that they've actually arrived today to get vaccinated. Of course, you can't turn them away, but is that perhaps one of the challenges that you're also facing with those that actually aren't supposed to be getting vaccinated? Part of the eNCA trial are arriving today.
Talking about the people, the elderly people, remember we're in the system. We still have those healthcare professionals or healthcare providers who are still working in a different institution. Some of them, yes, they are above the age of 60, between ages 60 and 69. who are still, some of them are medical practitioners, some of them are retired nurses but they're working at old age homes, some of them are those who are NGOs. Those are the number of people that you see, elderly people that you see outside. Because they are doing patient contact, we cannot send them away. We have to vaccinate them because they are still regarded as healthcare providers.
But my question, rather let me rephrase, if you do see those above the age of 60 that are not healthcare workers and that have arrived to get vaccinated, what do you do in that situation? Do you have to re-register them? Do you allow them to get the vaccine? Have you seen that happen today?
Unfortunately, we haven't received people who are not healthcare workers coming here. All the people that are coming here are healthcare workers. We have never experienced that. And I hope that once we experience that, we will deal with it as it comes. We have never experienced that. Unfortunately, I cannot say that we as healthcare workers, we are not allowed to send people away. But remember that according to the message which was sent by the president of the country, is that the non-healthcare workers' time is coming. For now is for only healthcare workers that we are assisting. But we'll deal with the situation when it comes.
Okay, and then just lastly, sir, speak to us about how important it is for South Africans to consider taking the vaccine. We know that government has said nobody's forced or compelled to take the vaccine, but how critical is it for South Africans to consider this, despite the fact that we saw a hold on AstraZeneca and that program was not implemented, and then we saw a hold on J&J. There seems to be some kind of panic and anxiety amongst South Africans and possibly healthcare workers. How crucial is it for us to get this vaccine?
Yes, it is very important for South Africans to understand that vaccination is a line of protection that we are having at this point in time. I mean, if you are a person, you believe that there's COVID, you have to believe that this vaccination will definitely assist. So that is our last hope that we are having, to say that once you are vaccinated, then you'll have that protection. So we are really encouraging everybody to heed the call, to come for vaccination. Remember, to achieve that herd immunity of 70% and above. That means that we will be protecting even those who are not immunized. If you get immunized, you are protecting somebody next to you who's not immunized. So it is very important for a South African to understand that the vaccination is the way of protecting ourselves against this monster disease.
Fantastic. Thank you so much for your time. So we really do appreciate it. I think there's some crucial information coming out to us with regards to this specific vaccination centre, how many people they've seen vaccinated so far. We understand it's over 8,000 since the start of this vaccination centre when it was open. And I know we've run out of time, but I'm just going to quickly move out of shot so I can show you this vaccination centre is up, fully running. You're seeing healthcare workers coming in, getting vaccinated. There's a whole process that's until you get to this actual point where you get the jab. But this vaccination centre is, of course, up and running, and you can see healthcare workers coming in to get their vaccine.
Yeah, wonderful scenes to see, certainly, in as far as those healthcare workers getting vaccinated is concerned. Thank you for that, Heidi Giokos. Hopefully, we see scenes like those with members of the general public pretty soon. I mean, it's crucial. I don't think we need to, belabor the point too much that actually this is crucial to get it going as soon as possible.